Major Friedrich Hoffmann stood frozen in the doorway of the American Field Hospital, his medical kit hanging limply at his side. It was November 3, 1943, and the German doctor had been captured just 4 days earlier during the Allied push through Italy. What he witnessed now in this American Mobile Army surgical hospital near Naples defied 16 years of carefully crafted Nazi propaganda. Before him, American surgeons in blood-spattered gowns worked frantically over the open chest cavity of a wounded soldier, a German soldier. 3 American GIs with shrapnel wounds waited on nearby gurneys while the enemy combatant received life-saving care. "Impossible," Hoffmann whispered in German, his medical training immediately recognizing the complexity of the thoracic procedure being performed. The American surgical team didn't pause their work as a nurse explained to Hoffmann in broken German that the Wehrmacht private had sustained a pneumothorax and severe vascular damage that required immediate intervention. "But your own men are waiting," Hoffmann protested in English, gesturing to the wounded Americans. The American chief surgeon, Captain Robert Mitchell, barely looked up from his work as he replied, "Triage is by medical necessity, not uniform. This man will die without immediate surgery. Your countrymen will receive the exact same standard of care as our boys." What Hoffmann observed in that moment defied everything the Reich's propaganda ministry had told. Germany's medical corps about American barbarism and disregard for the Geneva Convention. The meticulous care, the advanced equipment, the abundance of medicines and blood plasma, all being used to save a German soldier while Americans waited their turn. As he would later write in a letter smuggled to his wife, "What I witnessed that day was not just surgical skill, but the collapse of everything we had been told about our enemies. The Americans had enough medical supplies to treat everyone, a luxury we haven't seen since 1939. I fear we are fighting a nation that can afford to be humane even in the depths of war." The story of Major Hoffmann was just one of thousands that would unfold in American field hospitals and POW medical facilities throughout World War II. What began as isolated incidents of shock among captured German medical personnel would eventually become one of the most profound examples of how America's industrial and medical abundance would not only win the war but also conquer the hearts and minds of those indoctrinated to hate them. This is the story of how American medicine became an unexpected weapon against Nazi ideology, not through propaganda, but through the irrefutable evidence of care that contradicted everything Hitler's regime had proclaimed. The seeds of this story were planted long before the first German POW arrived on American shores. Since Adolf Hitler's rise to power in 1933, the Nazi propaganda machine had worked tirelessly to portray America as a nation of mongrel races, cultural degeneracy, and moral bankruptcy. Joseph Goebbels, Reich Minister of Propaganda, had specifically targeted American healthcare in his broadcasts and publications, describing it as a system where only the wealthy received treatment while the poor died in the streets. German military doctors were taught that American medical training was inferior, that their techniques were outdated, and that racial mixing had corrupted American medical science. By 1941, when the United States entered the war, the average German soldier and officer genuinely believed that being captured by Americans meant receiving little to no medical care. This belief was reinforced by carefully edited footage shown in German newsreels depicting primitive field conditions in American training exercises. The reality couldn't have been more different. By the time the United States entered World War II, the American medical establishment had been transformed through unprecedented investment in research, training, and infrastructure. Between 1940 and 1945, the United States would produce over 5 billion doses of penicillin, enough to treat every Allied soldier 35 times over. American pharmaceutical companies manufactured more than 27 million packages of sulfa drugs annually by 1943. The blood donation program established by the American Red Cross collected over 13 million pints of blood during the war years. These numbers represented not just manufacturing capability, but a philosophical approach to medicine that prioritized abundance and universal access within the military system. In stark contrast, Germany's medical supplies had begun rationing as early as 1941. By 1943, German field hospitals were reusing bandages, sterilizing them in field autoclaves when supplies were available. Penicillin was so scarce that it was reserved exclusively for elite units and high-ranking officers. The German Medical Corps had begun prioritizing treatment based on a soldier's perceived value to the Reich, a practice directly contrary to the medical ethics most German doctors had been trained to follow before the Nazi rise to power. This disparity created the perfect conditions for the psychological shock that would occur when captured German medical personnel encountered American military medicine. Dr. Ernst Weber, a surgeon with the 15th Panzer Division, captured in North Africa in May 1943, recorded in his journal, "They have mobile X-ray units in tents just behind the front lines. We had to leave ours behind in Tunisia because we lacked the fuel to transport them. The Americans bring their wounded and ours to fully equipped surgical theaters within an hour of injury. We had been abandoning our severely wounded for months because we could not evacuate them quickly enough." The statistics told a story that no propaganda could conceal. By mid-1943, the American military medical system had deployed over 600 field and evacuation hospitals across all theaters of war. Each was equipped with standardized surgical kits containing more than 300 instruments, a level of preparation that German medical units could only dream of by that point in the war. Mobile blood banks followed American combat divisions, ensuring that whole blood, not just plasma, was available within miles of the front lines. The Luftwaffe flight surgeon Colonel Walter Schreiber, captured after the fall of Tunisia, was permitted to observe an American field hospital as part of his POW duties. His official report, later found in captured German archives, described an embarrassment of resources that makes mockery of our own medical situation. Their lowest-ranking medic carries more supplies than our battalion surgeons. They discard what we would treasure. This material reality created a crisis of faith among German medical personnel who had been indoctrinated to believe in both German superiority and American inadequacy. When faced with the overwhelming evidence of American medical capability, many experienced what psychologists would later term cognitive dissonance, the mental discomfort that occurs when beliefs clash with irrefutable evidence. This dissonance was particularly acute for German doctors whose training in scientific observation made them ideal witnesses to the reality of American capability. As the tide of the war turned against Germany following the Allied invasion of Normandy in June 1944, the number of German POWs in American hands increased dramatically. By December 1944, more than 371,000 German prisoners were held in camps across the United States. Each prisoner received the same medical screening upon arrival: dental examination, chest X-ray, blood test, and treatment for any existing conditions. This standard process created countless moments of revelation. Oberstabsarzt Senior Medical Officer Klaus Miller arrived at Camp Atterbury in Indiana in August 1944 with a tubercular lesion in his left lung, a condition he had hidden from his superiors in Germany for fear of being removed from duty. "I expected perhaps isolation, at best some rest," he wrote in a memoir published after the war. "Instead, I was scheduled for surgical intervention within 24 hours of diagnosis." The American chest surgeon explained the procedure as though I were a private patient, not an enemy combatant. When I asked why they would waste such resources on me, he seemed genuinely confused by the question. This pattern repeated itself thousands of times across the American POW system. German prisoners with chronic conditions that had gone untreated due to wartime shortages found themselves receiving comprehensive care. Dental problems, nutritional deficiencies, orthopedic issues, conditions that had been deemed too resource-intensive to address in the Wehrmacht, were routinely treated in POW camps. The medical records from Camp Breckinridge in Kentucky show that between January and December 1944, American doctors performed over 3,000 dental procedures on German POWs, including 928 complete reconstructions requiring precious metals and materials that were rationed even for American civilians. For many German medical officers, the most shocking revelation came in the form of surgical prioritization. The Geneva Convention required that POWs receive the same standard of care as the capturing nation's own troops, but few Germans believed this principle would be followed in practice. The testimony of Dr. Hans Liebermann, a surgeon captured in Italy, illustrates how wrong this assumption proved to be. In February 1944, Liebermann was permitted to assist in the camp hospital at Fort Carson, Colorado. During his first week, 3 emergency cases arrived simultaneously: an American guard with appendicitis, an American soldier from the nearby base with a broken femur, and a German POW with an intestinal obstruction. Liebermann observed as the American medical staff triaged the cases based solely on medical urgency. The German prisoner went into surgery first, Liebermann noted in a letter to a colleague, also in American captivity. The American doctor explained that bowel obstruction presented the most immediate threat to life. I waited for some indication that this was exceptional treatment being demonstrated for my benefit. It never came. This was simply their procedure, regardless of who wore what uniform. 2 days later, I watched as precious plasma and a new sulfa drug were used to combat infection in another German POW, while a shipment of the same supplies was awaited for the American post hospital. When I asked about this apparent priority, the American captain said simply, "He needs it now, they don't." In that moment, I understood that everything we had been told about American medical ethics was a lie. The impact of these revelations extended beyond individual epiphanies. As German medical personnel were permitted to participate in the care of their compatriots, they became students of American medical techniques, pharmaceutical supplies, and equipment. This transfer of knowledge had not been planned as psychological warfare, but it became one of the most effective means of demonstrating American industrial and scientific superiority. At Camp Aliceville in Alabama, Hauptmann Captain Wilhelm Krauss, a German medical officer, was invited to observe an unprecedented treatment protocol. Penicillin, still so rare in Germany that frontline hospitals never saw it, was being administered to German POWs suffering from routine infections. They gave this miracle drug for common wound infections, Krauss recorded in his journal. In Germany, we had heard rumors of this new medicine, but believed it to be experimental and rare. Here the Americans had standardized protocols for its use in cases we would treat with basic antiseptics, if at all. The psychological impact intensified when German medical officers learned about the scale of American pharmaceutical production. In 1944 alone, American companies produced over 200 billion units of penicillin. This single statistic, when shared with German POWs who understood the strategic implications of such production capacity, did more to undermine faith in German victory than any propaganda film could have achieved. At Fort Leonard Wood in Missouri, captured Sanitätsoffiziere, medical officers, were given a tour of the camp's medical supply depot, a standard orientation procedure that took on unintended psychological dimensions. Standing before shelves stocked with supplies that had become mythical in German field hospitals, many experienced what one prisoner described as the mathematics of defeat. Captain Dieter Schultz, a veteran of the Russian front, broke down when shown the camp's reserve of surgical dressings. "We had been cutting bandages from paper in Stalingrad," he later recounted. "Here were thousands of sterile dressings stacked to the ceiling for a camp of prisoners. One room held more supplies than I had seen in the last year of service. I realized then that we were not just fighting an enemy with different ideals, but one that inhabited a different material reality altogether. The abundance extended beyond medicines to include equipment, facilities, and even food, all components of medical care. The nutritional standards in POW camps provided a stark contrast to the rationing that had become normal even for German officers. The standard American POW ration in 1944 provided approximately 3,400 calories daily. More. than German frontline troops received and nearly double what German civilians had access to at home. This nutritional abundance had visible medical consequences. Military records show that the average German POW gained 12 to 15 pounds during their first 6 months in American captivity. This weight gain became a form of irrefutable evidence that transcended language barriers or ideological resistance. Bodies that had grown lean through years of wartime rationing transformed before their owners' eyes, providing daily proof of American productive capacity. For medical professionals among the prisoners, this transformation had profound implications. Dr. Werner Schmidt, a nutritionist who had worked with the Wehrmacht's ration planning division, found himself confronted with the consequences of Germany's resource limitations in the most personal way possible. "I had helped design the reduced ration system for our troops in 1942, Schmidt wrote in a post-war account. "We had calculated the minimum caloric intake needed to maintain fighting effectiveness. It was a matter of necessity. Germany simply could not produce enough food to maintain pre-war standards. In America, I watched as our men consumed meals that contained more protein in a day than our soldiers received in a week. The Americans used white bread as a daily staple when it had become a Christmas luxury in Germany. Their coffee was real, their cigarettes plentiful, their chocolate abundant. These were not special privileges, but standard issue. Perhaps the most powerful example of this contrast came in the area of surgical capability. German medicine had once led the world in surgical innovation, but by 1943, wartime shortages had reduced even university hospitals to performing only essential procedures with minimal anesthesia. In American POW hospitals, German surgeons witnessed operations performed with what seemed like careless abundance. Ether and nitrous oxide used liberally, blood transfusions given routinely, antibiotics administered prophylactically. The case of Lieutenant Karl Brandt illustrates how this surgical abundance could transform a dedicated Nazi into a reluctant admirer of American medicine. Brandt, a fervent party member since 1935 and a physician with the Waffen-SS, was captured in Normandy with a complex fracture of his femur and tibia. In German field hospitals, such an injury often resulted in amputation due to the risk of infection and the resources required for limb salvage. Brandt expected the same in captivity. Instead, he underwent a series of operations at the POW hospital at Camp Forest, Tennessee, where American surgeons used newly developed techniques of internal fixation, bone grafting, and aggressive antibiotic therapy to save his leg. The procedures required 7 operations over 5 months, consuming countless hours of surgical time and thousands of dollars in materials and medications. "They have saved a leg that Germany would have sacrificed," Brandt wrote to his brother, also a physician. "Not because our surgeons lack skill, they may even be more skilled through necessity, but because we lack the materials that Americans take for granted. They used 14 pints of blood during my surgeries. 14! Do you remember when we had to choose which of 10 wounded men would receive our 2 available units? They changed my cast 8 times to check for infection. They used enough penicillin to treat an entire company of our men. And they did this for an SS officer who had fought against them just months before." What Brandt didn't write, but later admitted in post-war interviews, was how this experience began to undermine his ideological convictions. "I had been taught that American medicine was inferior because it lacked the racial purity and discipline of German science. Yet here they were, performing procedures we could only theorize about in Germany, using techniques and materials that made our most advanced military hospitals seem primitive. How could a racially mixed, democratically chaotic society produce such medical excellence?" This question ate at me during my recovery. The psychological impact of American medical care wasn't limited to those who received it directly. The POW mail system, though censored, allowed for the communication of these revelations back to Germany. Letters describing the medical care received in captivity circulated among families and communities, creating cognitive dissonance among the civilian population as well. When Unteroffizier, Sergeant, Heinz Wagner wrote to his wife about receiving dental implants in captivity, luxury treatment unavailable to all but the highest Nazi officials in wartime Germany. The letter was passed among neighbors in his Dresden apartment building as evidence that perhaps conditions in America were not as described in official news reports. The American military, recognizing the potential of this unplanned psychological operation, began to systematically document the health improvements of German POWs. At Camp Shelby in Mississippi, military photographers created before and after portraits of malnourished prisoners who had regained healthy weight. These images were not used as propaganda during the war, but the intent was clear. They would serve as evidence of American humanitarian treatment and material abundance when the conflict ended. This documentation extended to medical records that tracked the resolution of chronic conditions. Respiratory ailments that had gone untreated in the resource-starved German military cleared up under American care. Skin conditions disappeared with proper nutrition and hygiene. Dental health improved dramatically. Each recovery became a data point in an unintentional but powerful demonstration of what American industrial might could accomplish, even for enemy combatants. For the German medical officers who witnessed this transformation among their troops, the implications extended far beyond individual health outcomes. They were seeing, in microcosm, the fundamental material reality that would determine the war's outcome. If America could afford to provide this level of care to prisoners while simultaneously supplying the largest military operation in history, how could Germany possibly prevail? Oberstabsarzt Wilhelm Müller, captured in Sicily in 1943, articulated this realization in a journal kept during his captivity at Camp McCain in Mississippi. Today, I watched as an American supply truck delivered cartons of sulfonamides to our camp hospital. The quantity would supply a German field hospital for 6 months. When I commented on this to the American pharmacist, he laughed and said it was a routine weekly delivery. I have calculated that the medical supplies I have seen in this single POW camp exceed what was available to our entire division on the Eastern Front. How can Germany win against such abundance? We are not merely fighting an army, but an enemy economy that produces more in surplus than we can generate with our total national effort. The impact of these revelations became particularly acute as the war in Europe reached its final stages. German medical officers who had been in American captivity for a year or more received news of deteriorating conditions in their homeland with the bitter knowledge of the contrast. Dr. Friedrich Weber, held at Camp Bowie in Texas, received a letter from his wife in Munich in February 1945 describing how she had waited 12 hours to have their son's broken arm set, only to be told no anesthetic was available. That same week, Weber recorded in his diary, I assisted in the American camp hospital as they administered general anesthesia to a German prisoner for the removal of an infected wisdom tooth. The American dentist apologized that they had to use an older anesthetic rather than their newest agents, which were temporarily out of stock. I did not tell him that in Germany, such a procedure would now be performed with no anesthesia at all. The contrast was too shameful to acknowledge. This shame, the recognition that one's own nation could not provide what the enemy offered as a matter of routine, became a powerful force for ideological conversion. Medical officers trained in scientific observation and ethical care proved particularly vulnerable to this form of evidence-based persuasion. They could not dismiss what they saw as propaganda because their professional training required them to acknowledge empirical reality. At Camp Concordia in Kansas, a group of 23 German medical officers jointly signed a secret document in December 1944, a medical assessment of what they had witnessed in American care compared to conditions in Germany. Intended to be hidden and preserved as evidence for future generations, this extraordinary document provided a clinical analysis of American medical and industrial superiority from the perspective of trained German observers. We, the undersigned physicians of the German armed forces, feel compelled to record our observations of American medical capabilities as witnessed during our captivity, the document began. We do so not as an act of betrayal, but as a scientific record that may benefit future German medical development. What followed was a 14-page assessment comparing American and German capabilities in pharmaceuticals, equipment, training, nutrition, and preventive medicine. The document concluded, "The disparity we have observed cannot be attributed to temporary wartime advantages, but represents a fundamental difference in industrial capacity, scientific application, and resource allocation. Germany's defeat is inevitable, not because our soldiers lack courage or our officers lack skill, but because we are attempting to overcome a material reality that no tactical genius or ideological fervor can surmount." This assessment, hidden in the binding of a medical text and discovered only during the cataloging of repatriated POW possessions in 1947, represents perhaps the most clear-eyed German analysis of why the Third Reich faced inevitable defeat. It came not from military strategists or political theorists, but from doctors who had witnessed American capability in the most concrete and irrefutable way possible, through the daily practice of medicine. The transformative power of this medical abundance extended beyond the war years and shaped the post-war relationship between the United States and Germany. Of the German medical officers held as POWs in America, nearly 22% would eventually emigrate to the United States after repatriation. This extraordinary statistic speaks to how completely their worldview had been altered by their experiences. Dr. Erich Kästner, who had served as a surgeon with the 12th SS Panzer Division before his capture in Normandy, became emblematic of this transformation. Returned to Germany in 1946, he found the German medical system in ruins and his pre-war beliefs thoroughly undermined by his American experience. "I had seen what was possible," he wrote, in his application for immigration in 1949. "I had practiced medicine with resources that allowed for optimal care rather than desperate compromise. Having experienced this, I could not return to the limitations of post-war German medicine without bringing what I had learned. America had conquered me not through force of arms, but through demonstration of possibility." Kästner would eventually join the staff of Johns Hopkins Hospital, bringing with him techniques of field surgery developed under resource constraints that would influence American trauma care. This exchange of knowledge represented the final irony of the POW medical experience. The captive had become not just a convert, but a contributor. The statistics of this medical migration are telling. By 1955, more than 700 German physicians who had been POWs in the United States had joined American medical institutions. They brought with them not just their training and experience, but the powerful narrative of their conversion through evidence. Their testimonies, both formal and informal, helped shape the German medical system's post-war reconstruction along American lines. Even those who returned permanently to Germany carried the impact of their experiences. Dr. Werner Kirchner, who had been the chief medical officer of the 371st Infantry Division before his capture in Tunisia, became a leading advocate for healthcare reform in post-war West Germany. His frequent references to American systems and practices earned him the nickname Der amerikanische Doktor among his colleagues. "What I am proposing is not the wholesale adoption of American methods," Kirchner clarified in a 1952 address to the reconstructed German Medical Association. "Rather, it is the recognition of what I witnessed firsthand, that abundance in medical resources is not merely a luxury, but a strategic advantage. A nation that can heal efficiently preserves its most valuable resource, its people." This perspective, multiplied across hundreds of returning medical officers, helped cement the post-war German embrace of American medical technologies, pharmaceutical products, and system designs. It also contributed to the broader acceptance of American influence in West German Reconstruction. Men who had once believed American society to be degenerate returned to Germany as unofficial ambassadors for American methods and values. The medical care of German POWs represents one of the most successful psychological operations in military history, all the more remarkable because it was never designed as such. By simply following the Geneva Convention and applying standard American medical practices to enemy prisoners, the United States had delivered an unanswerable argument for the superiority of its system. No propaganda film could have been as persuasive as the experience of a German doctor watching American surgeons use precious blood plasma to save a Nazi soldier while American wounded waited their turn based on medical triage protocols. No radio broadcast could have convinced as thoroughly as the sight of penicillin being administered to German prisoners for infections that would have been left to run their course in Wehrmacht field hospitals. No leaflet could have communicated as effectively as the simple reality of gaining 15 pounds through standard POW rations while families at home struggled with subsistence diets. The story of German medical officers in American captivity reminds us that the most effective persuasion comes not through argument, but through demonstration. The United States didn't win the ideological battle against Nazi Germany through proclamations of democratic values or denunciations of fascism, but through the daily evidence of what its system could produce and how those products were distributed, even to enemies. As Dr. Friedrich Hoffmann, the German physician who witnessed American surgeons operating on a Wehrmacht private in that field hospital near Naples, wrote after the war, in that moment watching American doctors use their abundant resources to save a German life, I realized that the war had already been decided, not on the battlefield, but in the factories and laboratories that made such care possible. Germany was not merely being defeated, it was being rendered obsolete. Perhaps the most profound legacy of this medical encounter between enemies was its influence on the post-war generation of German physicians. The sons and daughters of these POW doctors grew up hearing stories not of American barbarism, but of American abundance. Many followed their fathers into medicine, carrying with them the lesson that had been learned through direct observation, that medical ethics transcended national boundaries, and that abundance made possible the highest expression of those ethics. The story of American medicine's impact on German POWs serves as a powerful reminder that nations demonstrate their true values not through what they proclaim, but through what they provide, even to those designated as enemies. In the clash between Nazi Germany and the United States, the ultimate victory was won not just through superior firepower, but through superior care. The doctors who witnessed this disparity firsthand became the most credible witnesses to an abundance that ultimately proved more persuasive than any ideology.